This video will be about dietary supplements. So, the first thing we need to think about when we're considering assessing dietary supplements is why do people use supplements? Well, a study found that 1 in 4 adults in the US report difficulty paying for prescription medications. And this, I assume, since COVID has probably only gotten worse. So, alternative and complementary medicine, aka ACM, although not covered by insurance, individuals believe it'll be more cost effective. So, compared with those with private medical insurance, people without insurance are more likely to report cost related non-compliance. So, that means that they are unable to take their medications because of a cost. And people that were younger than 65 were more likely to report cost-related non-compliance. That could be because that is when I believe it's Medicaid kicks in and it's a little more robust than Medicare. People with chronic conditions were more likely to report cost-related non-compliance. That's because with chronic conditions, these costs build up. And so this drives individuals to alternative or complementary medicine. But people also use herbal supplements because it's kind of in human nature. We have the desire to become the expert. We saw this a lot in COVID. Suddenly, people with no medical background in the world were suddenly experts in COVID. And so it used to be that the primary source of information about supplements was from books and magazines, think like Self or Men's Health or Women's Health magazines, parents or grandparents, friends. But right now, the internet is the primary method for people investigating herbal supplements. 1 in 3 American adults use the internet to learn about a health concern. And that's even when MDs say, don't Google this. Other reasons why people take herbal supplements is the belief that herbal supplements or herbal medicines are quote unquote natural. They may have had a positive experience in the past, or they have the feeling that traditional medicines are overprescribed and dangerous. And a big part of this comes from the opioid epidemic, where opioids were overprescribed and are dangerous. But people don't understand that not all medicines are opioids. Not all medicines are addictive. There also may be a family tradition of using herbal medications. And this doesn't mean herbal medications in general. It can be only 1 or 2 herbal medications, or it could be like a family tradition of using Chinese herbal medicine. Overall, 82% of people using herbal medicines believe there are no interactions with prescription medications. 82%. This is a dangerous number. So, the other thing we need to think about is who's prescribing, or because you can't really prescribe these, who's recommending? Number 1 are sports medicine physicians, but also chiropractors. Chiropractors make me feel like this. Osteopathic doctors, female physicians more so than male, general family practitioners more so than psychiatrists, OBGYNs, or pediatricians. And so that's what this graph is kind of showing. On the x-axis, this is any sort of complementary health practice, so massage, chiropractic, or osteopathic manipulation. What we're really interested is right here, herbs and non-vitamin supplements. So we see that the most people that are suggesting this are general family practice. We see that fewer pediatricians, OBGYNs, or psychiatrists are suggesting people take these. Interestingly, these also tend to be the least competitive specialties in medicine, whereas OBGYN and pediatrics are more competitive. So it could be just a lack of knowledge in these MDs. So who's taking these supplements? 1 in 5 adults in the US report taking an herbal supplement. Almost 20% of the adult population reported the use of an herbal supplement to treat a medical illness within the past year. And 75% of those who admitted using herbal supplements disclosed those to their healthcare provider, which means 25% didn't tell their doctors. And what's most alarming is that because supplements don't require a prescription, there's no age rules for them, a lot of teenagers are taking supplements. Why are they taking supplements? Well, they can just walk into Walmart or GNC or wherever and buy any of these supplements. So we see, let's look first at, these are the younger kids. Younger kids mostly taking a multivitamin. When we get to high school students, though, we see that mostly it is vitamins, but we see that they're also taking them for energy and for weight loss. And interestingly, this is much more pronounced in male teenagers, a lot more for energy, for muscle building, and for weight loss. And then in our kind of young adult category, we see a lot of weight loss. And this is really problematic because these supplements aren't harmless. We see that weight loss supplements are associated with death, disability, and hospitalization, more so than, say, vitamins. Although vitamins and energy can also result in death. But we see that weight loss ones tend to be life-threatening and require some kind of intervention. And the bottom line is supplements aren't effective. No clinical trials have shown high efficacy of supplements compared to standard of care. So this table shows the 10 most commonly used herbal medicines in the US. Oops. First being Echinacea. It's commonly used for like colds or upper respiratory tract infections. Again, inconclusive. Ginseng is also very popular, particularly for physical and cognitive performance. Really no evidence that it does anything. Ginkgo biloba may be useful for dementia, but it's also used for a bunch of other stuff that is probably not going to work. St. John's wort, which we mentioned, has a bunch of interactions and is used for depression, has numerous drug interactions. And then here are our other ones: peppermint, ginger, soy, chamomile, kava kava. But what I want to point out here with the kava kava is this severe hepatotoxicity. So people generally don't think of herbal supplements as being toxic, but several herbal supplements can be toxic to our livers. And this is called herb-induced liver injury, a liver injury related to herbal medicines. And there's 15 herbs that have been related to herb-induced liver injury. The first one is He Shou Wu, or it's also called Futi or Shu Wu Pian. It's used for backache, dizziness, interestingly for liver disease, graying of the hair, and constipation. Green tea extract, which is a weight loss supplement. Kava kava, which has been used for anxiety and insomnia. Greater celandine. Germander, again, another one for weight control and management of diabetes and hyperlipidemia. Skullcap, kratom, Tunsenkui or Jinsenkui, Garcinia cambogia, which is another weight loss, Ma Huang or ephedra. We'll get to that, but it is a stimulant and has been used for weight loss. Chaparral, which has been used for weight loss. Aloe vera, senna, jinbu huan. So you saw that there was multiple that were related to weight loss. So let's just look at green tea and kava kava. So we see that green tea, which again is used as a weight loss drug, had side effects that required liver transplantation, as well as corticoid use, supportive care. Most people recovered from it, but a couple of people did die. 7% died. Again, we see that similarly, people taking skullcap, kratom, or kava kava also required liver transplant. This Garcinia cambogia, we see also required a liver transplantation. So there's a lot of things that can be hepatotoxic. I can't go over all of them in this lecture, but I do recommend this website. It has a lot of information on drug-induced liver injury. What we're really going to focus on is not all supplements, but are herbal supplements that are used for weight loss. And this is one of the fastest markets. So some of the common ingredients in herbal weight loss supplements: green tea, chromium picolinate, ephedra, ginger root, guarana, plain old caffeine, hydroxycitric acid, Siberian ginseng, cayenne, and bitter orange. The general method of action for herbal weight loss supplements is that they suppress appetite and they increase energy. And things that suppress appetite and increase energy are often things like amphetamines, which have a high potential for misuse, especially if you're a teenager. That just bought these in the grocery store. Weight loss supplements are also often contaminated with pharmaceutical ingredients. So this is a study out of Iran, I believe, but they looked at a variety of different weight loss supplements, and they analyzed them for pharmacological drugs. And just as kind of a translation, fluoxetine is Prozac. Prozac results in a loss of appetite. Tramadol is an addictive narcotic. Rizatriptan is a migraine medication. Venlafaxine is an antidepressant, also known as Effexor, also will cause a loss of appetite. Methadone is an opioid agonist, and Ritodrine is a smooth muscle relaxant that can increase gluconeogenesis. But if we look here, many of these products or herbal supplements contain antidepressants and narcotics, caffeine, antidepressants and narcotics again. And so these are things that would, one, interact with other medications, but also, if taken in large amounts, can cause overdoses. So Garcinia cambogia is an ATP-dependent citrase lyase enzyme. It stimulates the breakdown of citrate into oxaloacetate and acetyl-CoA, but it has no proof of weight loss utility. Similarly, green tea, also called Camellia sinensis, can influence the sympathetic nervous system, increasing energy consumption and triggering the oxidation of fat, but again, no clinical effect. And when we drink green tea, the effect is probably caffeine. Chromium picolinate is used for weight loss and type 2 diabetes, but there's no evidence of long-term weight loss. Similarly, conjugated linoleic acid, no reliable clinical evidence. Hoodia gorderoni. This was one of the most popular weight loss supplements, and I can remember being a kid and watching like E, and there was all of these Hoodia advertisements. But there's very few studies evaluating the efficacy and or safety, and this plant is actually close to an endangered status. A similar plant to Hoodia is Cyanchum auricautum, and it has no efficacy or safety studies either. Another one is chitosan. This is the polysaccharide version of chitin. Remember, we find chitin in the cell walls of bugs, crustaceans like crabs and lobsters, and fungi. It binds to fat and is supposed to prevent absorption. It's better studied, but the effect is not clinically significant. Gambesin, this was actually a herb that was designed at the Kwang Hee University and Korean Medicine Hospital in Seoul, South Korea. It has clinical trials that are underway, but currently no evidence of its efficacy. And I really liked this quote: herbal supplements are widely marketed and commercialized, yet the evidence in support of their effectiveness is either non-existent or point to a negligible effect. There are also several herbal supplements that people take in hopes of relieving diabetes symptoms. There's weak evidence of a possible benefit of chromium or alpha lipoic acid that might be helpful to diabetic neuropathy. But popular herbs with no reliable evidence include cinnamon, bitter melon, fenugreek, and fenugreek is particularly problematic because there's an increased risk of bleeding if it's used with an antiplatelet or anticoagulant agent, such as warfarin, and it should not be used in pregnant women. It has an oxytocic activity, which can cause miscarriages. Ginseng also has been suggested for people with diabetes. There's no evidence that it does anything, but it does have an interaction with warfarin. Milk thistle and sweet potato, again, these have no effect on diabetes. And when I say sweet potato, I'm not talking about the food, I'm talking about sweet potato extract. Other ones that sometimes get thrown around are nicotinamide and vitamin D. So alpha lipoic acid is an antioxidant. It's currently being studied for its effect on diabetic macular edema and neuropathy. The data is mixed, and high doses can cause stomach issues. Chromium has been studied as it may impart a slight improvement in blood sugar, but it does have the problem that in large doses it can cause kidney damage, muscular problems, and skin reactions. Nicotinamide, there's weak evidence that it may help preserve beta cell function in patients newly diagnosed with type 1, but it's more frequently used for hyperlipidemia. And again, remember that nicotinamide is derived from niacin. And therapeutic doses of niacin can reduce total cholesterol. Niacin does have efficacy to raise high density lipoproteins. And when used in moderate to high doses, it may lower LDL and increase HDL. The mechanism for this is theorized to be that nicotinamide inhibits lipolysis and decreases liver triglyceride formation. It may also increase LPL activity and inhibit ApoB100 and very low density lipoprotein generation. So it has a significant role in the reverse cholesterol transport. Some of the adverse effects, though, to high niacin intake are flushing, aka blushing or redness. It can also cause a peptic ulcer. At very high doses, it could cause hepatotoxicity, arrhythmia, vision problems, and hyperuricemia. So if someone is on niacin for dyslipidemia, you need to monitor their uric acid, blood glucose, and potassium. Vitamin D gets thrown around for a lot of different things. It may have the potential to decrease the progression of type 2 diabetes, but we really don't have any randomized controlled trials. The observational studies that we do have assess an inactive form of vitamin D. And again, these are cross-sectional or observational, so we can't say any causality. That's all for the herbal supplements lecture. All in all, herbal supplements aren't necessary and at worst can be detrimental to a person's health.